Hello everyone, it is a great honor for me to participate in the conference this year. Let me first briefly introduce myself and the subject of the day before going into any discussion. My name is Qiyue Zhang. I am a grade 12 student in Sino-Canada program at Soochow University High School in Soochow, China. The paper I will be presenting today is titled Social Anxiety Disorder Among Teenagers. This title page provides some personal information about me, such as my name and affiliation, which I already stated. Also, my educational email is listed here. After knowing this, I will formally start my talk regarding social anxiety disorder among teenagers now. To give an abstract, this paper aims to present the current understanding of social anxiety disorder among teenagers. Not only the impact, but also treatment will be illustrated, together with references for future research and improvement. Overall, it is hoped that public awareness is raised over this topic. I would begin by giving an introduction on the prevalence of social anxiety disorder in the school context through a survey, showing the results and implied problems. According to a survey conducted in 2022, over a quarter of about 1,500 students reported themselves to have intense social anxiety, which around 10% of the initial sample are actually diagnosed. However, only 12.9% of those who were diagnosed were already receiving treatment. From the result, we can see that a sizable proportion of the students who are diagnosed is not under treatment, and that indicates the problem that not enough attention is being paid to the patients. In consequence, it can cause misleading and incorrect views for both the patients themselves and those who are around them, harming them a lot. The second part to mention is social anxiety disorder among teenagers, which is divided into the meaning of social anxiety disorder and the characteristics of teenagers. Social anxiety disorder can be defined as extreme anxiety or fear when being in social interactions or activities, such as performing in public, being watched eating, and meeting unfamiliar people. Common symptoms when being around others are shown, including physical discomfort like trembling. The etiology of social anxiety disorder is often considered sophisticated. In a biological aspect, first-degree siblings have 6 times larger risks of having social anxiety disorder. The second thing is environmental factors, which include the influences of family, like the over-control and over-protection of parents, and culture, like a society with a strong collectivistic orientation. The last but also the most important factors are psychological ones, which include inferiority, behavior inhibition, and post-traumatic experiences. For instance, someone may feel inferior because of his appearance and body shape, resulting in shyness and anxiety in front of beauties. Students who have always had poor grades will not have confidence in themselves, resulting in more and more fear of being looked down upon due to their grades, and being awkward in front of everyone. The next thing to talk about is the characteristics of teenagers, and as a teenager myself, I would have more say in these topics. The first but also most obvious characteristic is sensitivity, meaning that teenagers are caring a lot about the comments of others, including the praise of peers and criticism of adults. In addition, teenagers have a rather high level of self-esteem. The third and fourth characteristics are often mentioned together, which are rebellious and independent. There are some students who see loneliness as a symbol of specialness, and in terms of independence, they would do everything to try to get away from the control of their parents. Some extreme examples, such as when the kids decided to leave their home without announcing anyone suddenly to avoid supervision, are happening all over the world. An individual's daily life may be severely impacted by social anxiety disorder, both in terms of physical health and social functioning. As a result, not only are social relationships harmed, but also work productivity and academic scores are reduced. The impact of social anxiety disorder can be divided into 4 parts. For the first one, mental health. Patients may resort to extreme behavior to express their dissatisfaction, including suicidal and self-mutilation intents, which are more common among patients with comorbidities, such as severe depression. The next thing is social problems. Their absence from social activities is considered as violation of social norms, and in the long run, they will be no longer accepted by the society. The third impact is on their academic performance. Based on what I observed from school, social anxiety will lead to difficulties in presentation due to their fear of being judged. The last thing is employment, which is a problem they are facing after graduation. Considering their communication problems, it will be even more challenging to find a job that is suitable. There are 2 types of treatment for social anxiety disorder: medication and non-pharmacological treatment. Each of them has a unique significance in treatment. Medications, examples including those that are listed on this page, are approved by the Food and Drug Administration to ease the physical symptoms of social anxiety disorder. They function differently, either through raising the brain level of special chemical or lessen anxious sensations. It may take at least 4 to 6 weeks before any improvement happens, and a combination of different medications is often needed, depending on the cases. However, taking medication without changing anything in their minds is sometimes useless, so medicines are usually used to supplement non-pharmacological therapies. Cognitive behavior therapy, also known as CBT, is when faulty and strange thoughts are identified, challenged, and replaced with more objective and realistic ones. Recent comments have raised the alarm that, in comparison to those without mental illnesses, people who already have emotional and behavioral problems may get worse during COVID-19. When associated with CBT, it is also influenced heavily as lockdown limits this exposure and may encourage an avoidant attitude. The second, third, and fourth one focus on directly facing their fears, removing the fear response, and accepting pain respectively. To sum up, although studies have been conducted, a clear limitation is shown that not enough attention is paid to teenagers, and that can be solved via multiple ways. As a result of the emphasis on adults, the problems of teenagers are sometimes ignored by psychologists. Improvement as soon as possible needs to be made so that a more inclusive environment is created. It can be the responsibility of everyone in the society, from peers and adults. Classmates can act to support the patients, stop laughing at those who make themselves embarrassed during class time, while adults can start to encourage their kids more. For another thing, it is also necessary to consider the current situation, which in this case is the influence the pandemic brings. Knowing the changing time is of great value, and always following the latest rules will also help. That's all of my presentation. Thank you for listening.